It is Breast Cancer Awareness Month, and it's more about than just wearing pink. Dr. Jean Marie McGowan joins us today. She's an internal medicine specialist at Sanford Women's. So today we're going to talk about obviously mammograms and any other screenings that need to happen. So first of all, what do people need to know, really about Breast Cancer Awareness Month? What are we focusing on?
Sure. So the statistics are that it's still 1 in 8 women will be diagnosed with breast cancer. We're seeing women diagnosed as early in their 20s, but most commonly in their 50s or 60s.
And still are the guidelines, wait till you're 40 to have your first mammogram?
So there's a few different guidelines out there right now. The United States Preventative Task Force recommends discussing with your physician if starting at 40 to 44 is a good idea. 45 to 49 maybe discussed every other year, and then over 50 every other year. Now, if you look at the American Cancer Society guidelines, American Radiology guidelines, they recommend starting at 40 every year. We are seeing the more aggressive cancers present in younger women. Mm-hmm. So I myself recommend my patients to get annual mammograms starting at 40. But this is definitely a discussion for you and your physician, because many of the guidelines recommend making an individualized decision whether you should start at 40, 45, 50, and when you should do it either every year or every other year, and when to stop. So right now the guidelines recommend stopping at 75 or when you're within 10 years of life expectancy.
Can we talk a little bit about early aged women?
Sure.
And so obviously they're probably doing self exams, which I know we're going to talk a little bit about that here. But what do you recommend for young people? And what puts them at risk, or what puts them, in a position to say, hey, I need to get this checked out?
Sure. So age is still the biggest risk factor for breast cancer. There is about, I think 10% of breast cancers are genetically linked. So actually not a large proportion of those diagnosed, but still large enough, and it affects many women.
Definitely.
So you want to know if there's a family history, especially a first-degree relative like your mother, sister, or daughter. If there's second degree, how many second degree relatives you have add up. What age you start your period, what age you start menopause, how much alcohol you drink, a lot of processed foods, do you live a sedentary lifestyle, if you've had an abnormal mammogram before. These are all risk factors. Okay,
I was just going to say, those sound like risk factors to me. So anything else that you want to talk about as far as risks, making somebody high risk? You talk about density.
Sure.
And breast density.
Yes. So it became a law a few years ago in many states to report breast density on the result letter that goes out to women after they've had their mammogram.
Okay. Yes.
Because the denser your breasts are, meaning more gland tissue compared to fat tissue, makes it harder to see those cancers, because any gland tissue shows up as white. But so does breast cancer on the mammography. Okay. So when you have extremely dense breasts, a lot of gland tissue, it's going to potentially hide that cancer, which puts you at high risk. Having high density breasts itself puts you at high risk, but doesn't cause more deaths for breast cancer than not. We don't know why having higher breast density puts you at risk for breast cancer, and there's not a whole lot you can do to change that. However, living healthy and reducing your other risk factors, watching how much alcohol you take in, what you're eating, are you exercising, all those things that you're doing for other health reasons, like good heart health, is going to help you for breast cancer risk reduction as well.
Absolutely. So it's, breast cancer has touched many of us. Do you have any tips or anything for those of us out there to deal with things, or just to take care of ourselves? Sure.
So we definitely recommend self-breast awareness. You might not have to do a self-breast exam every single month anymore. We were finding a lot of things that were normally abnormal, if you will.
Right.
That was leading to excess testing. But you know your body best. So if you find something new that hasn't been there and it persists for at least a few months, like 3 months maybe, and it doesn't change with your cycle, if you're post-menopause and you find it, then you should come in right away and have an exam with your physician. And then they can order a diagnostic mammogram as well as an ultrasound.
Okay, lots to think about. Lots on our minds this month with breast cancer awareness, of course. And so making sure that we get in and get those mammograms this month for sure.
Yes.
And if not, as soon as possible.
Yes, don't let the pandemic stop you. You should continue with regular cancer screenings for sure.
Yes, thank you so much for being with us today.
It's my pleasure. Thank you so much.
Coming up on today's show, we are talking about body-focused repetitive behaviors, what it is, and how we can help those around us experiencing it.